morning, everyone. So today we're reporting 57 new cases of COVID-19 in the state. This includes 13 new hospitalizations and 4 new deaths. One from a Brown County resident, two in a Minnehaha County resident, and one in a Todd County resident. We've had 91 new recovered individuals from COVID-19, as well as 911 new negative tests that have been performed. This brings our total case count in the state to 4,710 COVID-19 cases. Of those, 1,037 individuals have active infections, and 3,619 individuals have recovered. We have 101 individuals who are currently hospitalized and 54 deaths in total now. And we have received 33,296 total negative tests that have been performed in the state so far. For community impact map, we have no new updates. For the new cases by county, we have 13 in Beadle, 2 in Brown, 1 in Charles Mix, 1 in Coddington, 1 in Davison, 1 in Day, 1 in Gerald, 3 in Lincoln, 1 in Lyman, 11 in Minnehaha, 3 in Oglala Lakota, 10 in Pennington, 4 in Roberts, 1 in Stanley, 2 in Todd, 1 in Turner, and 1 in Union. For new cases by age range, we have 4 in the 0 to 19 year age category, 15 in the 20 to 29 year age category, 16 in the 30 to 39 year age category, 6 in the 40 to 49 year age category, 11 in the 50 to 59 year age category, and 5 in the 60 to 69 year age category. For new cases by sex, we have 23 that are male and 34 that are female. For the deaths that we have reported, we have deaths by county, which include 2 in Beadle, 1 in Brown, 1 in Gerald, 1 in McCook, 45 in Minnehaha, 3 in Pennington, and 1 in Todd. For deaths by age range, we have 3 in the 30 to 39 year age category, 1 in the 40 to 49 year age category, 8 in the 50 to 59 year age category, 9 in the 60 to 69 year age category, 5 in the 70 to 79 year age category, and 28 in the 80 and older category. For new cases by sex, for deaths by sex, we have 25 that are male and 29 that are female.
Thank you, Dr. Clayton. I'm going to go ahead and unmute the lines, and then we will take your questions.
Good morning, JP from KYN News Radio.
Go ahead, JP.
Thank you very much. Could you give us a breakdown of the tests that have been conducted so far in the nursing homes and assisted living facilities? How many positives and how many negatives thus far?
Sure, JP. This is MALSAM-RYSDON. We have a total, this is as of this morning, 1,899 residents tested, 2,754 staff tested. In addition, we've got 6,600 tests that are in progress, so those are happening over the next couple of days, and then 4,400 tests scheduled. Those would be combined numbers between residents and staff, and that would be between the tiers 1 and 2 nursing homes in our state. We are not able to release results of these tests yet. We're waiting until we have more of the data complete, but I can tell you that the number of positives has been very low, so we appreciate that.
Thank you.
Next question.
This is Joseph Barkoff from the Capital Journal.
Go ahead, Joseph.
Good morning, y'all. Thank you. So a couple quick questions. One, and laws of probability I understand, but this is the third person in the under 40 age group. Did this person, the first person had underlying, the second person did not, does this person, and then can you give a quick update on all the recoveries for Demcoda and Smithfield and the other place and stuff? Thank you.
So for the recoveries, we have 117 of 149 from Demcota, 16 of 59 from Jack Links, and 841 of 853 who are Smithfield cases, as well as 245 of 245 that are close contacts to those cases that themselves became cases. As far as the specific question around risk factors or comorbidities, I should say, for the individual in that 30 to 39-year age category, I'm still looking that information up, and we'll follow up with you.
Next question.
This is Beth Orton with Dakota News Now.
Go ahead, Beth.
Yes. Are you planning to do any ongoing testing for staff that are going in and out of nursing homes and care facilities?
Sure. So, Beth, after the mass testing happens in a particular facility, then we'll move into a sentinel testing phase where we would expect 2% of the population of residents and staff to be tested on a weekly basis. And that would be of just random asymptomatic people so that we can try to stay ahead of COVID in any of these facilities.
Thank you.
Next question.
Ben Chase, the Huron-Daily Plainsman.
Go ahead, Ben.
We had a confirmation come out from Jack Links and LSI last evening of an employee there who has passed away. I guess curiosity is just how long that process will take. Just confirmation. Understand it's typically a couple of days. Just confirmation from your end on that. And with the location of LSI and the fact that it really draws from multiple counties, that's going to be attributed to one county, but that's still really an outbreak that affects multiple counties, and how that's really, I guess it's still a struggle to me, and how do we attribute that to one county right now in that outbreak?
So,
there are multiple counties being affected right now by an outbreak at one facility. That's, I guess, the question there is, are we seeing more than just employees coming back on numbers right now? Because to me, there's more than 59 that we're seeing coming out of LSI employees right now that are showing up in numbers from the various counties.
Yeah, so, the information that we provide is, we don't associate deaths necessarily with a specific employer, but we do associate them with their county of residence. So regardless of, whether they crossed county lines, to work. So that death, once it's reported, will be reflected in that individual's county of residence.
Yep. And I'm just, I guess, follow up on that is just curious if, you mentioned 59 with LSI, and curious if that is employees only, or if we are talking employees plus contacts at this point, or if contacts have been factored in yet.
So what we are reporting on are those cases that are, specifically that are employed at the Jack Links facility, not any individuals that may be close contacts. And I think it's important to recognize that, while we're using and identifying individuals based on their employer, that is not the only location where they are having potential exposure. So, whether we're seeing additional cases, within a household or even among members or employees of a certain business, that does not represent the only exposure that they have within a community.
Yeah.
Next
Thank
question.
you.
Jeremy Fugleberg, Forum News Service.
Go ahead, Jeremy.
Yeah, just again on the Jack Links facility, could you just identify what the Department of Health is doing with that facility? Have they reached out to you asking for help? Are you there giving them any guidance? What's the situation there?
Jeremy, this is Kim MALSAM-RYSDON. We reached out several times to share information with the folks at Jack Links, and hope to continue to partner with them. We've offered mass testing and also PPE to the degree that that's needed. We do know that they've made some changes to their environment to help with physical distancing, with hand washing and some of those kinds of things. And so we look forward to continuing to work with them to minimize the spread of COVID there.
Okay, thank you. And then one other question as far as the state lab capability, this is a separate question. The understanding I had was the state lab had a capacity of doing up to 450 daily tests, but that capacity was potentially going to expand another 1,000 tests depending on some new equipment coming online. Has that equipment come online?
Yes, it has. So we now have the capacity to run about 1,400 to 1,500 tests per day.
Okay, thank you very much.
You're welcome.
Next question.
Hi, Todd, Kello.com News.
Go ahead, Todd.
Yeah, just a minute. The emergency manager for Minnehaha County said the other day to the commission that he was not happy with some of the statistics that he is able to access concerning smaller communities in Minnehaha County, that apparently the testing results are based on the county where it's tested and not necessarily where that person lives in the county. Is there any sort of solution that you see that could give the smaller communities in Minnehaha County, and I suppose every county, so those cities and towns would be able to better plan for what they need to do to take steps against the coronavirus?
So, Todd, this is Kim MALSAM-RYSDON. We are aware that folks would like to see as much data as possible, and I think as you've looked at our website, as we've responded to COVID, we've been able to enhance the data that is available. The issue with reporting out at the municipality level is making sure that any information that we put out there does not lead to the identification of specific individuals. So when we're talking about smaller towns, that becomes problematic to report out because we provide the other demographic data that could help identify people. Having said that, if we continue to see, the numbers of cases get to a point where identification is not an issue, we would look to make enhancements to the level of data that we provide geographically.
And this is Dr. Clayton. The other thing I'd like to mention is that the results are reported out to the best of our ability based on where the individual resides. We are only able to report out what we receive, and so if we receive the individual's county of residence specifically for negative results, we're reporting that in our testing volume. But if those negative results don't come in with an address for the individual who was tested, then it does associate with the testing facility and may be put into a county that is incorrect in relation to where that person resides. But the other thing it's important to note is that all positive cases are investigated, and so we do have solid information on where those individuals are residing, which leads to some of the transition, both in terms of cases that testing positive may be associated with one county and then transition to another county at a later date. We still see some of that, as well as those negative results that as we get better information about where the person resides may move from the county where the specimen was tested or collected to the county of residence of the individual.
Next question.
This is Lisa with the Argus Leader.
Go ahead, Lisa.
Just wondering when you start reporting the antibody test results, if you're going to be reporting that in with the data every day, or is that going to be reported separately?
That would be reported separately. We want to make sure that there's a clear picture of what the current status of COVID-19 is in the state, and the viral RNA test tells you something different than the antibody test.
Next question.
Dan Christopher from the Watertown Public Opinion.
Go ahead.
I see Cotton County's increased by, I think, about 15, 17 cases in the last week here or so. I'm just wondering if you guys are able to share any definitive information as to why the increase or anything like that.
Well, one factor would be increased testing availability, and so it's common to see more cases when you see more testing happening, and we know that is happening in Todd County as well as on several reservation communities across the state.
Okay. And then one thing I heard is in Cotton here, there's about 5 cases in nursing home. I don't know if that's anything that you guys are able to confirm or anything like that.
Yeah, so the testing that is being done for long-term care facilities, does play into some of that increase. But I think it's also important to recognize that, as I'm reading off the list of counties where we are seeing cases, that, those are including some new counties that have not had cases previously, as well as counties where, they're making the list, that daily list, more frequently. So important to keep in mind that, we are seeing some increased, transmission, and reflective of that is increased testing capacity to detect those cases. And so, it's the main takeaway is that individuals should know what risk their county is in, where they reside and where they work, and take appropriate individual precautions to make sure that they're protecting themselves.
Next
okay,
question.
And then one
Go
final
ahead.
question.
Go ahead.
Since I'm kind of somewhat affiliated with the American News in Aberdeen, obviously Brown County recorded its first death. Are there any details that you could share regarding that or not?
No, the information that we provide is in aggregate to try and protect as much as possible the confidentiality of individuals who have died. The one thing that I do have as an update is that the person in that 30 to 39-year age category did not have other underlying chronic conditions. So that is 2 of our 3 in that age range did not have underlying medical conditions.
All right, thank you.
Mm-hmm.
Okay, we have time for one final question. We have time for one question. All right, hearing none, we will talk to you all tomorrow.